All right, this is the second in our series about encoder references. And the first thing we want to do is make sure that you get to this page in your encoder, or this screen, and we're going to talk about lab values. And you know, lab values are a really important part of coding, because lab values is a way for us to ensure that everything that was treated or investigated or found has been documented by the physician. So for instance, if you see a very high lab value that you know shouldn't be there, and you know that that particular value is associated with a certain condition, you can then go through the rest of your record and see, did they give medication to treat that? Was there a surgical procedure to treat that? Did they just monitor it and have the nurses monitor more? Regardless, then you need to go back and see, is it documented anywhere in the chart? If it isn't there, then you need to go do what? Query the physician. So lab values are an excellent way to find disease processes that are not documented by the physician. So let's go to our stack of books, and we'll click on that. All right, and where we're going to go is we're going to go to the Mosbys Manual of Diagnostic and Lab Tests, and you will find that right down here under the 3M Coding Reference Plus. I want you to point at it and click. So this brings us to this screen, and they have everything, you know, sorted out. They have ultrasound studies, urine studies, stool tests, blood studies, etc. But again, that's not a really efficient way of looking for things, because basically this is the book. This would be as if you had a book in front of you and you had a table of contents and you had to look it up. We want to do things efficiently, right? Because we are going to be working under productivity standards, etc. So let's go up again and see, again, we have the same icons as we had with Coding Clinic. Let's click on our binoculars. All right, so search word or phrase. Perhaps we want to look at, let's try a glucose. So let's type glucose in. We'll click search, and we get a great deal of information here. All of this is information. All right, so we've got glucose urine. Well, we don't want to look at a glucose urine. We want to look at a glucose test. So what do we have? We end up with, there's glucagon, there's glucose tolerance, glucose blood, glucose postprandial. So there's quite a bit there. We just want to look at plain old glucose blood. So let's click on that. We'll double click. And again, you will need to close this out manually, remember, so you can either click on the X here or you can cancel. And this will give you all kinds of information. And if you look here, we have sort of a table of contents that if we know exactly what we're looking for, we can click on it and it will take us right there. But what you'll find there are normal findings, normal ranges for particular things, normal accepted ranges. Then we'll find critical values, and that's going to tell us if we fall into these ranges or out of certain ranges. This is a critical value. It's an issue. It's either too low or too high. Right? It tells you what the test is for. Maybe you have a test that you don't know what they're testing for. Maybe you have some strange test. You can type that test in, come to this indications portion, and it will tell you what it is for. So we know that this test is a measurement of blood glucose, and it's commonly used in evaluation of diabetic patients. That tells us, all right? This also gives us a test explanation. How does it work? What is it really measuring? Why is it working? And it'll give you just extra information about the test itself. These are some factors that might interfere. It will give you interfering factors with the validity of the test. So, for instance, caffeine may cause increased levels. Therefore, many times what we're going to say is we want our patients to have fasting glucose tests. Now, fasting doesn't just mean not having food. Fasting means having coffee, tea, anything that may increase that level. right? Many pregnant women have some degree of glucose intolerance or glucose issues. So it will give you some things that might interfere with the readings. It will also give you procedures to the procedure and patient care. What do they do when they draw it? It will give you just some extra information, and then it will give you test results and clinical significance. So here we have, if you have increased levels of hyperglycemia, it could be any one of these. It could be diabetes, it could be Cushing's syndrome, it could be chronic renal failure, it could be acute pancreatitis, it could be diuretic therapy, it could be corticosteroid therapy. Many times cortisol or corticosteroids increase your blood glucose and you have hyperglycemia. If you have decreased levels of hypoglycemia, you could have insulinoma, hypopituitarism, extensive liver disease, insulin overdose, starvation. So what you want to use this for is to kind of give you a hint as to what you might be looking for. So if you see a patient has increased levels of hyperglycemia, sorry, I'm losing my voice, then you could start out by hunting around in the chart and looking for any one of these particular disease processes and seeing if you have anything that supports it. Same thing with the decreased levels of glucose or the hypoglycemia. You might also see some related tests. These are related tests that you may see if they do come up with an odd value. You might see these tests done to follow up. All right, so it just kind of gives you it's an excellent way to find information. If you don't know what a test is, it gives you lots and lots of good things to look for, hints, etc. So the whole idea is use it efficiently and use it to increase your knowledge of that particular, we all know that a blood glucose level is to test the sugar in the blood. This is going to give me more information. What could it mean? What do we do with it? Where do we go from the point that we know that they have an odd or an out of range finding? All right. So again, that is from Mosbys Manual of Diagnostic and Lab Tests.